Hello, everybody. This is Karen Grosz with Canvas Creek Coaching and Team Building, and I'm here with Cole Whitmoyer from Flex Family Health, who has an exciting announcement for us today, and we are going to talk about people and profits. So, Cole, introduce our other guest, if you would.
Yeah, and I'm the owner, nurse practitioner at Flex Family Health, and today with us, I brought our new family physician with us to, bring her onto the spotlight, and it's Dr. Jennifer Fowler. She's a doctor of osteopathic medicine, and she will be joining our practice on June 1st.
Tell us a little bit about Flex Family Health. What does that mean? What does that mean? What do you guys do for the world?
So we're what we call a direct primary care clinic. So we directly contract with our patients. We don't take insurances. We don't bill insurances. Rather, we charge a monthly membership fee that allows our patients or our members to have unlimited access to the clinic, extended visits, cheap labs. Well, I shouldn't say cheap, inexpensive labs. And also another big thing, 24/7 access to your provider. So either myself or Dr. Fowler, you can text message, call whenever you need something. It's just another way to practice primary care and give people accessibility as well as affordability and quality. And Jenny, I don't know if you wanted to elaborate on.
Yeah, when I think about this practice model, I like the idea of, Karen, if you need something, you just reach out in real time. Whoever, me or Cole, would get that message and see it and be able to react to that and deal with it. So if it's a refill request or whatever, normally that comes in through the receptionist, and then that has to get to the nurse, and then eventually it gets to the provider. It may not be your provider because that person might not be there that day. And, it takes 3-4 days, it seems like sometimes, to get that request completed, especially if there's any questions about, have you been following up? Are you up to date on labs? If that message comes directly to me, I can just look and make the decision. And if I have a question, I reach out to you directly, text you right back, and then get it handled. And it takes minutes instead of days. It's crazy how much time we waste in traditional medicine.
Yeah, so my backstory is that I really was rallying against the system earlier this fall. My mom was very ill, and I just thought the system is not working. And when I met Cole, I was like, holy cow, this is part of the solution. So I love that real time. That is so beautiful. Yeah. And really knowing who your doctor is and who's taking care of you, I think is really fantastic.
Yeah, absolutely.
Yeah. And you must like getting to know your patients. Is that really exciting for you to know who they are?
Yeah, exactly. That's why, for me, like outpatient primary care has been where I've thrived, because I like to spend the time, let people talk. If you let them talk long enough, they tell you what's wrong with them,
So excited about that. I think you're absolutely right. So you guys, tell me a little bit about what you're doing for customers as we go through this whole COVID thing, or for your clients. Are you seeing an uptick in them? Are you seeing that they require special care, special thinking to come into the office? Tell me what that's looking like right now.
Well, the great thing is that, again, with our clinic, we do televisits, we do text messaging. If people have questions about something, they let us know. And at the very beginning of this, I was super busy answering those questions. It's a scary thing, and it's a weird time, and it's kind of the crisis is causing us to have to change the way we do things. Here, we've changed some things, or we're doing things better, but our waiting rooms aren't crowded. We don't have to sit and wait if you have to come into the clinic. If we can handle it over the phone, we're going to handle it over the phone. Also, I think one of the big things that we've been able to do, and I guess getting back to your point just real briefly, we have seen it slowed down a little bit for us, but people are needing healthcare. And with our model that, of us being able to do that again in real time, and being able to ask more questions, we can kind of get things figured out without having a lot of contact. So yeah, we've really been thriving. with it as far as, new patients and things like that. And we're able to bring Dr. Fowler on. But, I think the biggest thing is, like Dr. Fowler said, the communication. I send a weekly email to all my patients, and we're outlining, hey, this is what we're seeing with COVID this week, or this is a topic. We're going to talk about antibody testing. We're going to talk about just the regular PCR testing. We're going to talk about all these things that you have questions about, so I can help answer those the best I can. If you don't, and if you need more questions, just email me back. So it's a really great way to practice during these times, and I think it's been very, very helpful to a lot of different people.
Yeah, it certainly has. I know I really have appreciated the care that you've given me in the last couple of months. I appreciate that a lot, and the accessibility. So let's talk about profitability a little bit. That's what chamber members are always interested in. How can I be profitable in the world right now? Do you have thoughts on that?
Well, I guess from our standpoint of being in healthcare, we know the expenses that are put on businesses, health insurance, getting health insurance for patients, whether or not to use those tools for your patients. And if you're a large business, you have to have something, and I guess finding alternatives to things out there. I started this practice going on eBay and getting wholesale things, and I'm on a lot of subscription stuff just to kind of keep costs low. I know what the costs are going to be. And that's kind of what we like to call ourselves too, is the Netflix and the Costco of healthcare, where you're getting a monthly subscription to all those great things at wholesale prices. So I think that's kind of finding things like that to be able to know your costs. And I guess for us, at least, that's been my goal, is to know our costs and know what it's going to be every month. And hopefully we can kind of control things that way. And the profitability will come with that. We're bringing on a doctor, Dr. Fowler. So, it'll take time, but again, knowing that your services are great and that you're offering a great service, I think that is half the battle too.
No pressure, Dr. Fowler, but the profits are on you.
Yeah, right.
Which isn't what he said at all. I think that's really interesting, Cole, the way that you are running your business and how wise you are. Not always in the medical field are you trained to run a business. And so you're doing a great job with that. So you mentioned in there a little bit about what you do for employers. And I think that's really important, how you can help employers keep their costs down with their employees. How do you take care of people?
Oh, and Dr. Fowler, do you want to talk about this a little bit? I think that, I know quite a bit about it. I don't know if, Jenny's been in that space for a while as well. And,
yeah. The idea, I think, with all of this is just, if you are taking good care of people, you've got people who have easy access to the clinic, it's not something that they're having to pay co-pays every time they go in, then they might actually use it. And if they're using it, you can keep people healthier so that they stay in the workforce and stay productive. And I think that's really the biggest selling point is, keep your people healthy, give them good access to care so that they stay at work and stay productive.
Excellent. So as an employer, I could sign my people up to be able to come in and see you.
Yeah.
Yes.
We've been, we have quite a few businesses that have signed up with us. A lot of the businesses that we have are either people that are entrepreneurs or self-employed that are owning their business, or even bigger businesses that they're under the threshold of 50 employees, where they don't have to offer health insurance. And we all know health insurance is really, really expensive right now. And so they want to offer a nice something, a retention tool. So they offer our services per employee per month. You're looking at, paying, if you pay one person's insurance for a month, you're looking at getting all of your employees almost for on our plan for primary care services. Again, I always have to say this in anything that I do, but we're not health insurance. We're not a health insurance plan, but we are, like a regular old primary care practice, and we can do about 80 to 90% of things that people will ever need. So that's kind of how we like to plug that.
Excellent. Dr. Fowler, anything you want to say here at the end of our call?
think I have anything specific to say. I'm excited to join this practice. Certainly new to the chamber, so I'm excited about what that's going to be all about, I guess. But yeah, I'm ready to get started.
Excellent. Okay. Well, I wish you absolutely the most success. Cole, what did you want to say?
I said we're ready too.
I know Cole's been very excited to get this happening, get this started. So best of luck to both of you. And everybody, thank you again for watching us talk about people and profits for the Chamber of Commerce. Again, I'm Karen Grosz with Cole Whitmoyer and Dr. Fowler. Thank you guys for being here today to learn from Flex Family Health.